Are you thinking about purchasing a Medicare supplement or a Medigap plan? Well, I'm going to share with you a couple of tips that I think are very important for you to understand before you make that decision. First of all, I want you to know that Medigap and Medicare supplements are the exact same thing. These are just marketing terms that they use, and they both mean the exact same thing. A Medigap Plan F with one carrier is the same as a Medicare supplement Plan F with another carrier. They're both the same thing. But there's some other things that you need to be aware of before you make that decision. One of which is looking at, is that carrier offered in your state, in your county, in your zip code? They all differ. Every one of them is different. Some are in one state and not in the others, and some are in one county but not in the others. So you've got to know that. The other thing I think that's different is that you need to understand some of the pricing variances from one carrier to the next for the exact same plan. And there are some bells and whistles that you should be aware of relative to the plans before you make that decision. Now, here's a pricing comparison to show you what I mean by that. If you look at the left-hand column, you'll see the association plan, which we all know who it is. It's on TV all the time. They only offer in one county Plan F. They don't offer Plan G. Those are the two most popular plans, but you only get Plan F. You have to factor in the cost of the membership along with the cost of the insurance to see if that makes good sense for you. But Plan F with the association carrier is the same as Plan F with any one of the other carriers on the chart there. Now, Carrier A is on TV all the time, and you can figure out who that might be, but they have gender-based rates, and their rates differ by county. So you can see their rates there. You can also see that they offer Plan G, which is a good thing. Carrier B, again, always on TV. It's one of the popular ones out there, but look at the rate. The rate is significantly higher. Multiply that times 12, and it's a significant increase in premium. And by the way, they also don't offer Plan G. Now look at Carrier C. Carrier C is a household name. Can't tell you who it is, but it's a major insurance company. You can see the plans, you can see the rates. The rates come down. Now look at plan Carrier D. You'll see it's a statewide rate, male-female rate, but you look at the rates, and again, you'll see that the rates are significantly less expensive. Now, there's other Medicare carriers out there. There's lots of them, as a matter of fact. These are the 5 most popular carriers. But the rates are different significantly, and the plan offerings are different. So it's important that you talk to someone that knows and offers these plans. If you just call the association, they only offer one insurance company. If you call the people on TV, they only offer one insurance company. It's important to look at the whole marketplace and see what's offered. Now, as a bonus, here's some tips that are going to help you save a lot of money when it comes to healthcare or medical expenses or pharmaceutical. I call these Tracy's Top Tips. And here's what they are. A national survey was recently done, and most people that purchase Medicare wanted to have a gym membership. Silver Sneakers is an awesome gym membership. Most of the major gyms in America participate, and you generally get your membership for free with certain carriers, but you got to know which ones. The other result of this survey talked about some discounts that you can get through goodrx.com or healthwarehouse.com. These are awesome warehouse internet-based services that you can provide your medication into, and you can see what the savings would be. Whether you have a drug card or whether you have copays, it's worth checking these out. The higher the cost of the drug, the bigger the discount. The other area to check out is the manufacturer of that pharmaceutical, of that drug, their own website, and see what kind of savings they might offer. Again, the more expensive, the bigger the discounts. And I have found with clients of mine that I've helped for years and years, they've all said this is the best deal ever, to go to the carrier website. Finally, look at Costco and Sam's. We all know who they are. Now, this national survey that was done by a very popular magazine talked about Costco and Sam's and did price comparisons versus the chains. And we know who the chains are. Costco and Sam's won every single time. In fact, I did my own medication surveys and also found out that these were the best. So these are tips that you might be able to use. Share them with a friend. I have never found anybody that wasn't unhappy with these tips. Now, I've been at Medicare for 29 years. And I'm glad to help you make this decision, because making the wrong decision could end up costing you thousands of dollars, and you may not ever get back to the Medicare plan that you want. So why don't you give me a call? I answer my own phones. I'm not a call center. Give me a call. I've been doing this for a long time, and I'll help you make the right Medicare decision that's best for you. But first, I need to know what you need and what you want and what you expect this plan to cover. So I'll offer free consultations for a very limited time, because open enrollment is around the corner and we will be swamped. So why not take advantage of it today by calling me at 440-549-7800. Call today. I'll answer my own phone, 440-549-7800, and I'm glad to help you. Thank you so much. God bless you.